I'm Lauren with Findmydentist.com, and today I'm going to be talking to you a little bit about dental stains and what we do as far as stain removal in an office setting. A lot of people associate going to the dentist and having a cleaning with having smooth, shiny teeth when they leave the dentist. This is a good thing because it often is a motivating factor for patients to clean their teeth because they like the smooth surfaces, and when they leave they sort of feel around in the mouth and the surface is smooth and nice, so that enhances their interest in brushing and flossing on a regular basis. What we do in an office is something called selective polishing. Selective polishing means that we only polish the teeth that have unsightly stain on them. If a tooth surface is clean, if it's free of biofilm, and if it does not have a stain, we won't polish it, because polishing all the teeth increases the risk that the enamel, which is the strong outer surface of the teeth, say we would have a tooth and this is the pulp. On top of the pulp would be the dentin, and then the dentin makes up most of the tooth in an adult, and then on top of that we would have enamel, which is the strong protective covering that is highly calcified. It's about 96% mineralized, which means it's extremely strong, and for that reason we want to preserve that because it prevents cavities and it protects us against decay more easily than the dentin and the cementum, which are less calcified. So polishing all the teeth creates a lot of friction. Polishing particles that we use are very abrasive, which is why we get that smooth surface when we're done polishing, but we don't want to do it in excess because we'll take a lot of the enamel off, and prevention of disease is far more important than having those smooth surfaces. You can achieve the smooth surfaces at home with proper biofilm removal, which many hygienists and dentists will teach in an office prior to polishing, so that you're kind of motivated to take that step and remove all that biofilm yourself, and you can achieve that really nice feel in the mouth at home a lot of times without polishing. After proper biofilm removal, if there are any areas left, we do polish them. We put light pressure and a polishing paste on. A lot of the polishing paste that we can use have flavors that are pleasing to the patient, which enhances the experience. We also have polishes that contain fluoride. Although these polishes contain fluoride, they should not substitute a topical fluoride treatment in an office or using fluoridated products at home, because there isn't enough evidence yet to show that using fluoridated polish can have as much of a benefit as some of these other things that we do have in dentistry to mineralize the teeth. Another facet of polishing agents that can exist sometimes is hypersensitivity agents. A lot of times this will seal off what's called the dentin tubules, and these are responsible for sensitivity when they're open in teeth. So if we can seal off those tubules while polishing, it's likely that you'll experience less sensitivity. Polishing paste can be offered in a number of different levels of abrasiveness. We try to use a low level abrasive on the teeth so that we do protect that rich enamel covering. And we can also use what's called a cleaning paste, which, unlike polishing, which the particles in polishing paste are jagged and abrasive, the cleaning particles are more rounded, and consequently they won't damage the surface of the enamel at all. They'll simply clean it. This leaves the teeth more shiny and gives them sort of a luster without having that smoothness that polishing paste can offer due to how abrasive it is. Overall, polishing is something that's offered to most patients unless there are a lot of restorations in the mouth that can't be polished. Again, we want to preserve the health of the teeth more than we want cosmetic benefits, and polishing is something that we think of in dentistry as a procedure that's purely cosmetic. It enhances the self-esteem of the patient, and oftentimes it motivates them to get better care of their teeth after they've been to the dentist. But if it's a matter of the health and the integrity of the tooth and prevention of disease, we will go that route before we will polish. I'm Lauren, and this has been Polishing the Teeth in an Office with Findmydentist.com. Thank you.